I'm Dr. Amy Bandy, and this is Kaitlyn Otison, and she's my patient coordinator, and we're here to discuss breast augmentation surgery with you, and that is with implants. So, welcome to our video. Basically, there are two different types of implants, saline and silicone, and there are pros and cons to both of those implants. Kate, when you discuss things with patients, what do you find are their biggest questions about saline versus silicone?
I think when picking between implants, the patient's biggest concern is their kind of aesthetic they're looking for, more of the natural teardrop shape versus more of a higher profile rounded look.
And I find that too with patients is that most of the time what they're looking for is a specific look. The feel isn't usually as important, but there are a subset of patients who are really focused in on what their feel of their implant is going to be. And that's where we get more in depth with the pros and cons on saline versus silicone. Would you agree?
Yeah, absolutely. And then I think when patients are looking to choose between saline and silicone, that size is a factor, especially since they're so well known for the extra large implants.
And that's true too, because with the FDA in the United States, the largest implants available in silicone are 800 cc's. So once a patient is wanting to go larger than that, their only option at that point is to switch to saline and do an overfilled implant. So the pros and cons of saline versus silicone, that's a big thing that a lot of patients want to know. Saline, one of the biggest pluses to saline is that it can be placed into the pocket before it's even inflated. So you can go through a smaller incision. There are multiple incisions that can be used for saline under the arm, around the nipple areola, under the breast in the natural crease, and then also the umbilical incision, which is not used often, but it can be if that's the preference of the patient. The saline implant comes completely empty. It gets rolled into almost like a little taquito form once the implant filler tube is placed. So it can be placed through a very small incision. Whereas silicone implants need to be placed through a bigger incision because they come pre-filled. Here's an example of a silicone implant. And the smallest you could really do is about maybe 1.5 to 2 inches, as you're going to have to push that implant through that opening. So obviously with a silicone implant, you're not going to use the umbilical incision. The axillary incision can be used for many of these silicone implants, but the bigger the implant is, obviously the bigger the incision needs to be, and so we have a larger tunnel, and that's something that I also discuss with patients. What do you find that they primarily look for as far as incisions?
In terms of incisions, I know that a lot of people have both aesthetic concerns and safety concerns, so it really just depends on what the higher priority is because we offer best options in both cases.
I find that most women who come in to have breast augmentation surgery are looking for a fuller profile to their breasts. Many times it's a woman who's already had children, childbearing. They've lost the volume that they had before they had their children. They've nursed, now their breasts look deflated and they are looking for a fuller profile. You can get that with both saline and silicone, and we go over the options of the pros and cons of saline versus silicone when you come in for your consult. We also do sizing so that you can get a really good idea about what your final profile is going to look like after surgery. And then we go over the different types of profiles of the implants. For example, with silicone implants, you have something that's more of a moderate profile, which doesn't have much projection, but it has a wider diameter. Then you have something a little bit moderate plus, where you've got a little bit more fullness and still a big enough diameter to give you cleavage. people who want the real popping look where you've got more projection, you want to go with more of a high profile implant. It's going to have a smaller base diameter, but definitely much more projection. And then there's the ultra high profile, where you get the maximum projection. And basically we find out what's going to be the best for you once you come in for your consult. The other things I know that, Kate, you talk to them about are the things that they're going to have the option to choose from. And what are those that you discuss with them?
So all patients for a first-time breast augmentation get to have their 4 options. So they pick their type of implant, saline versus silicone, their size, of course, after we go over sizing, their type of incision, and then whether they'd like their implant placed above or below the muscle.
And that's very true. Those are all very good things. And once they've discussed with us what their preferences are, we go over the pros and cons with each of their decisions, because then sometimes they may find that's what they thought they wanted, but now with more information, they're changing their mind. So there are always pros and cons to whatever decisions you make. We also do the overfilled saline implants for people who want the very, very fake Barbie doll looking projection of their implant and fullness in the upper pole. But you have to be the right candidate, and you have to understand what the pros and cons and what the additional risks that you're taking with extra large implants.
And I would say that's probably one of the things that you're the most well known for. And then you also have the option of just keeping your same implants as well, depending if you're a good candidate or not.
In our consultation, we go over the 3 different implant manufacturers for silicone, and that's Mentor, Allergan, and Sientra. Those are the 3 that are FDA approved, and you have a choice between each one of those. Typically what we will do if you're in office and you want to feel and touch and see the implants, we let you look at all the different variety of implants by all the implant manufacturers. You can tell the difference in cohesivity. How cohesive is the implant? Is it very, very squeezable, soft and malleable? Or is it a more cohesive implant which has a better fill volume, a little bit more resistance, but still has a good give? And some of that's going to give you a difference in the way it looks, but a big part of it is the way it feels. So we always let our patients look, feel, touch all the different implant manufacturers, and we go over the warranties for each of the different implant manufacturers so that you have a really good idea what you think you're going to be the best suited for. What do you find when patients are looking at the different implants, what their concerns and questions are?
So when talking to patients about the implants, I start by asking them what their priorities are, whether that's the implant warranty, the touch, or the look of the implant, and then based off of their goals, we go over their options. A lot of the time, the different manufacturers can all achieve the same aesthetic, but sometimes the difference in touch or the warranty will make the difference when choosing.
And that's what I find too. I think a lot of patients don't know where to start. They haven't really done their homework on the different manufacturers and the warranties. And so we try to educate you so that you have as much background as you can before you make your decision.